Good afternoon, and welcome to the presentation, Get Up and Move to Stop Obesity. It's getting York County moving during the workday, making healthier eating choices, and creating a healthier lifestyle. Why is this so important? Well, there's some alarming statistics. In Pennsylvania, 2 out of 3 adults, that's 6.2 million residents, and 1 out of 3 school-aged children have excess weight. Here's some York County statistics of people who live in York County. Overweight and obesity. What does that equal? It equals poor health. What does poor health equal? A lot of times chronic pain. In York County, where this program, Get Up and Move, was piloted, more than 245,000 adult residents are overweight or obese. 143,000 are limited in their daily activities by poor health, and about the same suffer from a chronic pain. So what is the mission statement of Get Up and Move? Well, the Pennsylvania Department of Health, in conjunction with the York County government, have a mission to work together to improve the health of York County residents. We're going to educate York County residents to engage in healthier habits. Get Up and Move to Stop Obesity. What's it about? It's a wellness program presented to work sites in York County. The object is to get employees moving during the breaks and lunch hour. So many jobs are sedentary, and with the pandemic right now, so many people are working from home, and that gives more opportunity to sit and more opportunity to snack. So we want to give ideas for healthier snacks and opportunities to learn about healthier eating. Our first goal is to reduce chronic illness of obesity and the chronic illnesses that accompany obesity, including diabetes, stroke, and some types of cancer. And goal number 2 is to transform a sedentary lifestyle to lifestyles of movement at the workplace and at home. We want to teach people what body mass index, BMI, is. Why does it matter? Is it important? Yes, it's important because wellness it's important because body mass index tells the doctor where you are as far as your health. For instance, a BMI below 18.5, you're considered underweight. 18.5 to 24.9, it's normal and healthy. 25 to 29.9, you're starting to go overweight, and we need to start working on that. And 300 and above is what's considered obese. And obesity is, like we said, where diabetes starts, heart stroke. So what are some ways to lower BMI? Physical activity, easy, inexpensive, and can be done indoors or outdoors, and all is needed is a pair of sneakers. Walking, that's the best physical activity you can start with. The simplest way to get moving. You can walk 10 minutes during your work break. You can walk half of your lunch hour and get out and away from your desk. Stop eating and working through lunch. After work, when you stop at the grocery store, park far away and walk to the doors. If you have children who have baseball practice or soccer practice, go to the park. Walk while they're practicing. The important thing is you breathe, you walk, and you regroup. Other ways to lower your BMI? Healthier snacking and lunch habits. Cut back on sugary drinks. Drink water. Bring fruit, yogurt, veggies, crackers, and cheese, instead of hitting that vending machine at 3 o'clock that's going to fill you full of sugar and carbs and then make another crash. Healthier lunch options. Pack your lunch starting 1 day a week. Then try 2 days a week. Move up to 3 days a week, 4 days a week, and 5 days a week. And then save going out for lunch for special occasions. The goals for our Get Up and Walk program, Get Up and Move program to stop obesity. The first goal was to reduce chronic illness of obesity. And the objectives were, by quarter 1, 10 work sites in York County would hold wellness programs to educate what obesity is and what diseases they can come from obesity and what can be done with physical activity and nutrition. Quarter 2, 50% of working adults within York County will know what their BMI is. Quarter 3, 50% of project participants will be packing healthier lunches at least 3 days a week. In quarter four, 50% of the participants will have moved from a sedentary level to low exercise. 25 will have moved from sedentary to moderate, and 15% will have moved from low or moderate to vigorous. Quarter one for the second goal, which was to transform sedentary lifestyles to a lifestyle of movement, is 50% of the employees at the 10 worksite will try their recipes for healthier snacks and walk during their breaks. Quarter two, 25% of the employees in the worksite that held wellness programs will walk on their lunch hours at least 3 days a week. Quarter three, working adults within York County will report a 10% reduction in drinking sugary drinks. And quarter four, by the end of year one, 50% of project participants will reduce their BMI by 5%. Summary of the first year. From the first 5 job sites, early information shows that 49% of the employees have gone from no or low activity to walking at least 3 lunch hours and 2 breaks a week. And 25% of the employees who classified themselves as moderate activity have increased higher levels of activity. We have lots of long-term goals. We want to involve all 67 counties in Pennsylvania on this worksite wellness plan to get up and move to stop obesity. We want to continue to increase activity in those already participating, introducing other forms of activity that they can do. Continue to offer nutritional ideas to employees through an email newsletter or live demonstrations. We want to continue to reduce the number of obesity and overweight in Pennsylvania in adults so they can educate their kids, because childhood obesity is just as high as adult. We want to lower the prevalence of diabetes, heart disease, stroke, and some types of cancer. I want to thank you so much for coming to the presentation today. I would like to tell you that Get Up and Move and Stop Obesity has been a great program in York County, and we would love to get it in all 67 counties. We need funding and to add extra staff to be able to reach out to all those 67 counties. We need to get the word out to employers about this wellness program, and we need confirmation to your patients that obesity is a chronic illness and needs to be worked on. Thank you again for coming, and thank you for helping us stop obesity.